Hello, my name is Philomina Chukwudike from Walden University. This poster explores post-discharge pediatric mortality in Nigeria, focusing on children under 5 years of age. Most child survival interventions have historically focused on preventing deaths that occur inside a hospital. However, evidence shows that a substantial number of these children die after they are discharged, often from preventable causes. Child mortality remains a major public health challenge in Nigeria. This post-discharge period has received far less attention from policymakers and healthcare systems in Nigeria. In Nigeria, the problem is particularly critical in low-income and rural communities where structured follow-up care and community support are limited. After discharge, children often return to environments with limited food, water, and healthcare access. Without follow-up, preventable illnesses such as malaria, sepsis, and malnutrition lead to death at home. Most research focuses on death occurring inside a hospital. Very little is known about what happens to children after discharge, especially in non-income settings. This quantitative study examined whether timely follow-up visits and healthcare availability reduces the likelihood of post-discharge mortality among children under 5 years of age. Two questions guided this study. First, whether timely follow-up visits reduce mortality. Second, whether healthcare facility availability affects survival in low-income areas in Nigeria. The study used 2018 Nigeria DHS data analyzing records of over 21,000 children under 5. A multivariable logistic regression was used to control for social ecological factors. Although the NDHS includes about 33,905 children, statistical power analysis showed that about only 1,005 were needed. Therefore, sample size was increased by 25%, giving a target of 2,105, which threatens confidence in this result. I'll begin with the descriptive characteristics of the key independent variables. In terms of household income, 28% of children came from poor homes, 15% came from richest household, 20% children received timely follow-up care, 78% did not receive. Maternal age, 15 to 49% reflects were included in the sample. Looking at access, healthcare follow-up, about 70% of healthcare caregivers reported no major issues, while 30% experienced major challenges. So this chart shows that which factors increase or decreases the chances of child death after adjustment. Simply living near hospital facility did not significantly reduce child risk. Children from wealthier households had better survival outcomes than those from poor homes. Children who received timely follow-up visits after children were less likely to die. Children from rich households had lower risks of death. Children from whose mothers had secondary education or higher education were less likely to die. Time follow-up was the strongest predictor of survival, and higher maternal education and household wealth significantly reduced mortality, while older maternal age increased risk factor on this line graph. So therefore, access alone is not enough. Effective follow-up systems, caregivers, education, and family support are critical for child survival after discharge. The study relied on survey data which can involve recall bias. Future research should explore caregivers' experience and track children after discharge. These findings can inform policy, improve healthcare workers' training and support. Thank you for your time and effort, interest. My contact is displayed here. Thank you.